My name's Paul. I'm from Smileyscope. We're transforming paediatric procedural experiences using virtual reality. I started Smileyscope because I was looking after a young man with cystic fibrosis who had been so severely traumatised that every 3 days for 3 weeks, I had to book him a gas sedation just to get bloods and just to change his drip. And I never wanted anyone to go through that ever again. So the more we looked, the more we found. And we found that procedural experiences are the most feared part of healthcare journeys. We found that they are a powerful driver of patient experience. They are a powerful driver of staff satisfaction. And not only that, they set the tone of encounters for life. We did a systematic review and meta-analysis. We involved over 100 patients, and we developed a new technique and patented it. We call this procedural choreography. So instead of this scary needle coming across me at the room, now we see a friendly fish nibbling at our arm. We ran the world's largest randomised clinical studies in the area, over 250 patients, and demonstrated 60% reductions in pain, 40% reductions in anxiety, and we halved the need to restrain patients. These data were so powerful, they directly led to the international infusion therapy standards of practice changing. 10 months from launch, 100% of Australian children's hospitals have adopted Smileyscope. We've transformed over 50,000 procedures in 4 continents. I'd now love to hand over to Jen to talk about the local experience in the US.
Thank you, Paul. So my name's Jennifer Hayakawa. We can go to the next slide. I'm the Director of Nursing Research and Innovation at CHOC. And we'll go to the next slide. I wanted to tell you guys a little bit about why we chose Smileyscope as one of our VR solutions. Like many organizations out there, we've been looking at different case uses for virtual reality and augmented reality within our hospital system. And we've explored diverse populations using it in patients, using it in families and staff, medical teams, for different reasons. And the one thing I really struggled with was the patient use. Because I'm a mom, I have 2 small children who are obsessed with gaming, they're obsessed with YouTubers, and so I know firsthand how relatable this technology is to that generation, and I see so much opportunity. But until I kind of partnered and met Smileyscope, I didn't realize that there were products out there that existed that really did solve some of these problems in a way that was meaningful to the kids. A lot of the equipment we had, a lot of the hardware and software that was available at the time was not meeting the needs of the children. And in fact, we had trialed and tested several different products within our organization that sat on the shelf and collected dust. And so I was very thoughtful about which product we were going to bring in, if we were going to bring in another product. So Smileyscope would appeal to me. It's designed for healthcare. It's designed specifically for pediatrics. The size, the shape, you can wipe it down. Everything appealed to me as a nurse. It was beautiful. I loved that while they do offer relaxation and breathing modules, the thing that sets Smileyscope apart is this procedural choreography that Paul referred to, which is incredible. So it actually integrates into the workflow. As a nurse, prepare my equipment, the child is preparing to go on an underwater sea adventure. As I am wiping them down with alcohol, they're experiencing the waves washing over their arm, and they really get into it. The ease of use is probably the biggest turn on for me for Smileyscope. The fact that it actually doesn't use handheld controllers, it's just simple headset that removes, the faceplate comes right off so I can hear and see immediately what the child is experiencing if there's any technical issues that we run into. But it turns out we don't run into very many because it is so simple. There's no Wi-Fi or internet connection, so we don't have some of the security concerns we've seen with other devices. And we don't have to rely on that because I've used this in places where, let's face it, our Wi-Fi connections can be a bit spotty at times. You can go to the next slide. So I'm going to tell you a little bit my personal experience. About the middle of the pandemic, when the kids' vaccines started coming out, we quickly mobilized a large vaccine clinic within our education center, a big auditorium at CHOC, which I'm sure many hospitals experienced. And with that came, hey, we have to staff this. We're trying to get everybody in the community immunized, we need to staff this. So they called on anyone that had an RN license to come and help staff. And so that included me. It pulled me out of my normal duties as a director of nursing research innovation. And so I was there staffing the clinic and helping to vaccinate these children. And I brought with me a Smileyscope. Just happened to be about the time I learned of this technique, of this device. And so I would literally put it on my arm and walk up and down the line of children that were in line waiting to go to one of the stations where they'd get their vaccine. And the kids were so interested and intrigued about it that a lot of them actually forgot about what they were there for and forgot about the anxiety that they were experiencing waiting. They were asking me, what is that? Can I use that? The parents were asking that. I personally used it on well over 100 kids, and I was overwhelmed. I mean, I knew it worked. There's data that shows that it works. I'm a scientist. I can understand that. But I was really impressed at how this little simple device could very quickly transform the experience for the kids and for their families. There was a big concern of, okay, we have to integrate this into the workflow. It's a choreographed procedure. I'm telling you, there's a 45-second module there that we learned how to quickly, within a patient or two, we were able to quickly integrate it into our workflow and save so much time. Think about, there was countless, and I'm sure people, if there's any nurses in the room, you've experienced this, countless numbers of minutes, hours of parents negotiating with their child before they're gonna get their vaccine. Oh, we'll just get it, it'll be quick. We're gonna go to Target after, we'll go get ice cream, we'll go do this, we'll go do that. This eliminated the need to have those lengthy conversations and negotiations with the kids. We were able to get them in the chair, get them into the experience, get their procedure done. And oftentimes the kids would take it off and say, when am I getting my shot? And we're like, well, we already gave you your vaccine. And they really honestly didn't know that they had received it. And I think it's just they had built up in their head how bad a shot or a vaccine could be. So much fear around that needle phobia that when they actually had it done with this device, it wasn't as bad as they had anticipated. So it's a novel and effective tool to add to our toolbox. Doesn't work, obviously, with every child. Every child responds differently. But it worked for me, in my experience, with surprisingly large number of patients in even the neurodiverse populations, and the parents absolutely loved it. The last slide, I just want to quickly talk about lessons learned, what to know if you're considering VR. For me, safety was a huge priority. Any children's hospitals looking at that. We want to know the equipment that we're using is safe for use in children. So Smileyscope has been FDA approved down to 4 years of age. So we were able to do that. We were able to quickly clean it down and wipe it and sanitize it between use. Selection, you got to tailor each technology's strengths to the specific needs of what you're looking at, obviously. And the biggest thing, I think, is staff training, ensuring that the people that are going to be using it are comfortable using the device, know how to integrate it into the workflow, making sure you're collaborating with your multidisciplinary teams to get that integration so that it's not sitting on a shelf somewhere in a month later. And then data collection, not just research and generation of new knowledge, but what's going to be meaningful data internally to know how to spread the device, where to spread the device, and what populations would be most benefited by this. Also, make sure that you keep an open mind, think outside the box, and really cast a wide net and explore different uses of the devices that you're using. For example, Smileyscope has been implemented in a lot of different places, a lot of different emergency departments, and they've documented over 35 procedural uses. So needle procedures, but you can expand that to phlebotomy, venipuncture, laceration repairs. There's a lot of needle procedures. And then there's also different new modules that they're constantly developing. So our experience with Smileyscope has been so positive. We have since invested in 14 devices across our organization, and we've built in more money for capital for next year, and we're negotiating additional devices. So thank you very much.
Thank you, Jen. That's amazing.